Trail and ultra runners, what is going on? What's happening? Welcome to another episode of the KoopCast. As always, I am your humble host, Coach Jason Koop, and this episode of the podcast is all about addiction in endurance sport, and specifically within the sport of ultra running. This is a topic that I have wanted to tackle for a very long time, ever since the inception of this podcast, in fact. Yet, I have not found the courage nor the right expert to bring on the show to date. But that all ends today. My guest today is Dr. Harlan Austin, PhD. Dr. Austin is a licensed psychologist with national certifications in sports psychology and addiction psychology. He has 2 decades of experience working in both the sport and clinical psychology fields. During his career, he has served in many roles, including performance consultant, clinician, program director, and clinical director. He has lectured and presented at national conventions on the topics of sport and performance psychology, clinical sports psychology, athlete psychological assessments, athlete rehabilitation, and athlete return to sport. Dr. Austin has also worked with a broad array of professional athletes in the NBA, MLB, NFL, boxing, lacrosse, ski, and snowboard. In addition to that, he has worked with professionals in the healthcare system, U.S. Special Forces groups, and high-level executives. And on the podcast today, we want to discuss the intersection of sports psychology, performance, and addiction. Now, although I have not personally suffered with addiction, it is a topic that is near and dear to my heart, and one that I have had to grapple with in both my professional and personal circles in too many ways to comprehensively cover in this intro. I dive into some of those connections during the course of this conversation, and what I ultimately hope that you, the listeners, can come away with is an appreciation for people suffering with addictions and a toolkit to help anyone that you think needs it. All right, with that as an intro, I am getting right out of the way. Here is my conversation with Dr. Harlan Austin. Thanks for coming on the podcast. As I was mentioning off air, this has been a topic that I've wanted to do for a long, long time. And honestly, the very first podcast guest that I had on this podcast was a person by the name of David Clark, who I know you're probably not familiar with, but he was a great dear friend of mine, and had this very prototypical life turnaround story where he was a alcohol and drug addict, as well as a self-professed fast food addict, over 300 pounds, and then became a fantastic endurance athlete. And he became a lifelong friend of mine. And ever since then, ever since he and I kind of partnered up to do a lot of radio shows and podcasts together and just collaborate on a lot of different things, I've wanted to tackle this very topic, but I've been reluctant to do so. And also finding the right practitioner to discuss this with has kind of eluded me thus far. So thank you for coming on. And from the bottom of my heart, I just really appreciate you taking the leap and discussing this with the audience.
I'm happy to be here. Thanks for inviting me.
So to start out with, just so people can get to know you and kind of your scope of practice a little bit better, can you kind of describe what you do professionally, and then more broadly speaking, what your entire group does? Because you have a very impressive organization built up that has I was astounded by the breadth of the professionals that you have underneath the umbrella.
Sure. Yeah. So I'm a sports psychologist, and I currently work with Premier Sports Psychology, which is pretty sure it's the biggest firm in the US of sports psychologists. And the work that I do certainly there's a couple of overlapping circles with it. So, my initial training experiences come from the sports psychology lens. And my doctorate is in counseling psychology with a specialization in sports psychology. And so through my doctoral work, the training was all aimed at becoming a sports psychologist. So that allows somebody to be a licensed psychologist with specialty training and supervision in that sport and performance psychology world. Along my career path, I also ended up working in the addiction world and getting certification in that realm as well. And then through the years of my career, have had an overlap between those two worlds. And certainly, if we think of it like a Venn diagram, the world of athletes and the world of addiction, there is an overlap of those two circles. And it's probably a bigger overlap than there is in the general population when we look at those two circles. Premier Sports Psychology was initially founded by Dr. Justin Anderson and Dr. Carly Anderson. They are sports psychologists that I met, early on in my training experiences back in the doctoral days. And they went on to create this firm that specializes in performance psychology and working with athletes of a lot of different levels. Certainly, Premier's worked with any number of different professional leagues, organizations, Olympic level athletes, down to the recreational athletes and, aspiring future stars in the youth sport realm. So through the years, they've grown, and I'm, recently transitioning to be a part of that team. And I'm very excited and very flattered to have been invited to be a part of that team.
So based on that, you're the perfect prototype practitioner. That was hard to say, perfect prototype practitioner to come on this podcast and discuss this, because like I said earlier, one of the things that has eluded me in trying to formulate a podcast with this particular topic is just finding the right person that exists within that Venn diagram overlap that you had just mentioned. So we are going to talk about addiction in sport and addiction within endurance sport and maybe even ultramarathon specifically. But before we do so, I think it's extremely important to start to lay some of the groundwork, because this word addiction gets used in two very different spheres. It gets used in a clinical sphere, and it also gets used in more of a colloquial sphere if we kind of look at the lay literature and the lay population out there. And everybody's out there, everybody listening to this podcast knows somebody or has been or has experienced this directly, where they've said, I am addicted to something. I'm addicted to sugar. I'm addicted to exercise. I'm addicted to whatever it is in a colloquial setting. And I want to make sure that we make this distinction kind of right off the get-go, just so that the audience understands kind of what we are fundamentally talking about. So when you are going to describe addiction throughout the course of the next, 60 some odd minutes of this podcast, how are you viewing that? How are you viewing that? And are you taking it strictly from a clinical diagnosis, or does it encompass a larger umbrella?
Yeah, it's a great question, because it really does have this two realms of meaning: the popular psychology or the popular language realm, and certainly the clinical lens that we look at things through. The interesting thing is there's not a diagnosis in our clinical manual with the word addiction. So if someone has an alcohol addiction, is not a clinical diagnosis you would ever get in a medical chart. Substance use disorder severe or alcohol use disorder severe is the clinical term for that. And so I think that addiction as a disease model is something that the clinical world speaks of, and understanding what happens to the brain and how the brain has changed when there have been repeated addictive behaviors, typically associated with a chemical, but not always. Sometimes it's associated with a behavior or a process. And so we call those process addictions, and we have chemical addictions. So those are ones in which we look at there being a problem in somebody's life as a result of what's happening. And that problem is biopsychosocial in nature. So it's not one thing, it's not one area, but multiple areas of somebody's existence that are clinically significantly impacted in a negative way.
So you mentioned earlier that you exist at this unique intersection of sport and addiction. And right out of the gate, one of the things, or one of the aspects of my professional life that has compelled me to want to do this podcast for a very long time is my professional experience, where I have had, over the course of the last almost 20 years now, I've been a coach for over 20 years as a professional. And I would say for about 18 to 20 of those, at any one point in time, my athlete roster has about 30% of its population that has recovered from or is in recovery from, whatever vocabulary we want to use there, any number of addictions, right? Some of them are eating disorders, some of them are alcohol addiction, some of them drug addiction, some of them kind of all three. And I've coached athletes kind of on both sides of that process, meaning while they were an addict, unknown to me, even as a coach, when they went through rehab and then kind of come out of rehab, I even have that experience. And so it's been mysterious and perplexing to me from a number of different angles. And the first one I kind of want to approach it is just the sheer proportion. So you mentioned that it might be more so than we give it credit for. What should we be giving it credit for? Is this something that more people are being affected by than we can kind of comprehend?
Yeah, if we're talking about athletes, we can look and compare them to the general population of folks that we wouldn't lump into the category of serious athletes. And let's not worry about whether we're talking about professional or not professional, but people who are serious athletes who have an athletic identity. And if we look at the general population, there are some varying statistics, but anywhere between 12 and 15% or so of the population will be able to be diagnosed with a substance use disorder at some point in their life. And we know that by comparing those populations, that the athlete population has a higher rate than the non-athlete population of being able to be diagnosed with a substance use disorder at some point in their life. And there are several factors that contribute to that, but we do know that we see higher incident rates of addictive disorders, substance use disorder diagnoses within the athlete population.
So my experience kind of matches up with that. And here's kind of here's ultimately what I want to try to convey during this podcast, or basically produce during this podcast, is I want athletes and friends of athletes and coaches that are out there listening to this to have some semblance of a toolkit, because this is something that I got to be honest with you, I was woefully unprepared for, and I still am under-equipped for in my professional career. And if you would have told me when I very first started that let's just say over 25%, right? My experience is about 30%. But over 25% of the people that you would actually work with during the course of your professional career has experienced some form of addiction. I don't know if I would sign up for that job, because once again, that's not how we're classically trained as coaches. We're trained in physiology, and there's a little bit of sports psychology and things like that. But that's a really remarkable statistic to just take into account from the onset for anybody who is thinking about working with athletes in any type of capacity.
Yeah, it's a lot, especially if you're thinking that in working with this population, I'm somehow going to be responsible to help them with that.
Yeah.
And that's a big ask, right? And I think from the coaching perspective, I would want to say that, being able to help someone is certainly not going to be under the purview of what you need as a coach. But what you want to do to be a great person is to be able to connect people to the help that they may need. And so I think when folks are in the realm of coaching, of pretty much anything in the athletic world, it could be athletic trainers, it could be physical therapists, the ability to understand what maybe some signs and symptoms are is a really valuable tool, so that you might be able to help refer. But you can't refer someone to help unless you can identify some of the signs first. And so that ability to identify and then just recommend, refer, help connect somebody to people that might have a little bit more knowledge about what the change process and how to help them with that change process might look like is a really valuable thing for folks in the sport world.
Okay, we're going to come back to the signs and symptoms in just a little bit. So let's earmark that and tuck it away for just a second. But I want to come back to this intersection of athletics and addiction. And you mentioned that the athletic population is at a higher risk. Why exactly is that? Or do we know why that exactly is? Like, why do athletes, and maybe even particular endurance athletes, have this higher, risk associated with that particular population?
Yeah. It's a great question. It is the question in the world of addiction in sport. There's not a simple answer to the question. Certainly, we can talk about some of the factors that other researchers have identified and thought to be contributors. It's not a simple thing to say, well, this is it for everyone. And so that's what makes it so complex to work with this population. But certainly, if we look at it from a lens of everything happens within a social context, and that's a part of this. And so often folks who are in a social world in which they're striving and they're trying to go hard and they're trying to achieve, there's also a reward part of that story, the celebration. And so culturally, in a lot of sports, just turn on the TV and what happens when somebody wins. We could go from car racing to a NBA championship or many different examples. And you see after they win the championship, what do you see? They're shaking a champagne bottle, popping the top, spraying everyone around them. And that is something that is, I think, throughout many, many different sporting contexts, the idea that there's a reward that comes at the end of this. Certainly it's ice cream when we're talking about T-ball and youth soccer, but it evolves over the years. And much like the general population that starts to experiment with celebratory social settings and using alcohol and drugs, the sport folks are no different. But they have a life in which celebration has more of a calendar to it. There's more opportunities for us to be all working towards the same goal together. We're all striving. And when we achieve, hip, hip, hooray. That's something that gets built in, and it creates the opportunity for folks to start to pair celebration and this key point in development when adolescents are experimenting in the world, and particularly in our country here, as we see that happening in the teen years. People are getting more and more serious with sport in those years. And you can start to see how those celebrations start to be modeled after what they see in others who have been in sport. Now, that's one side of it. Of course, there's the other side of that too, which is letdown and what happens when we don't win and how that's devastating. And then what gets role modeled around folks when you aren't feeling good, when you're feeling sad. And again, this is where we look at the social context in which people are in. And if we have a greater community in which people use drugs or alcohol for self-medication, and you have an athlete who grows up in that community, and then they are feeling sad or feeling let down because they lost the big game, because they're having a tough season, because they didn't run as fast as they wanted to run, they follow the models that are around them. And so that social component of, medicate when you celebrate and medicate when you feel bad is there in a social context. And athletes are growing up in the same social context as everyone else. The difference is they're also in this world in which there's these opportunities for successes and failures, maybe more often than some of their peers because of what happens through the nature of competition.
I hadn't thought about that before, that just simply because of this emotional athletic roller coaster that you're describing of the wins and the losses and having to go through those, that somehow that is it's almost like a flywheel, right? To transpose those highs and those lows and use a different mechanism essentially to achieve them, from sport to drugs and or alcohol. Is that kind of what you're describing there?
Mm-hmm. Certainly. And again, the role modeling that's around culturally, this is a thing in our country. Addiction is a thing. In general, 15% of the population are dealing with this, but even more than that are using drugs or alcohol in those ways. They maybe don't qualify for a diagnosis, but they're using them in those ways. And so athletes who have this accelerated opportunity to feel those highs and lows may start those habits earlier because they're just getting to experience it more often in their lives.
Well, and also I have the experience of, I work with a lot of very high caliber athletes, but I also work with a lot of amateur athletes that have the same characteristic where they are all in. Their whole life revolves around whatever they're training for at that one particular time. And there's a behavioral analog of being all in to what I've also seen, how they treat drugs and or alcohol, right? They take that all in mentality,
yes,
and they translate it over to a different, portion of their life and have kind of the same behavioral pattern, but underneath a substance as opposed to underneath an action worth this training. And it's always been hard for me to pick up on that or decipher that because I kind of know them through that personality. You know what I'm saying?
Yeah. And you're making a great transition from the social piece to this to the biological piece to this. So there is a biological component that's also there for athletes that may not be there for the general population at the same levels. And that is that striving and getting the rewards that are innate to participation in sport, right? So the wiring, the hard wiring in the reward system in the brain that's releasing dopamine that says, oh, that feels good, right? We access that through participation in sport. I mean, in particular, we're talking about ultramarathon running, right? It's this chasing that high, the runner's high that's there. Well, there are real neurochemical things that are happening with that. And so folks who tend to engage in sport get neurochemical rewards for engaging in sport. There's medicine in exercise, right? It's a clinically proven treatment for depression. And so we know that it does something. It changes neurochemicals in the brain. We get more of those happy chemicals that are released. And so some people, and it's a percentage of the population who engage in exercise behaviors, are going to get those and they're going to say, ooh, that feels really good. I need more of that. I need more of that. Not everyone who engages in exercises becomes addicted to exercise, but a percentage of the population is. Just like not everyone who drinks alcohol or smokes marijuana becomes a substance use disorder diagnosis person, but a percentage of them does. And so folks who are engaging in the rewards of sport certainly have some percentage of them that are going to end up responding to that dopamine release from a win, from the runner's high, from just the benefits of it in a way in which they're going to keep saying more, more, more. I want more of that.
Okay, so we're going to kind of get into signs and symptoms now. This is a good transition point because I don't want everybody to come away with, oh, well, if you, like you just mentioned, if you start exercising, you're predisposing yourself to becoming addicted to exercise. Just if you start drinking, you're predisposing yourself to become addicted to alcohol. And I want to set this up with a personal story. And this person would not mind me telling the story. It's out there in the public, and he and I have had many, many dialogues about this. And I think a lot of the old school ultra runners will actually recognize this person's name. So in the mid 2000s, I coached this guy named Jim Huffman, and he was a reasonably successful ultramarathon runner. He placed very high in Western States, very high in Wasatch, and I coached him for years. He and I had a fantastic relationship. I went over to his house a few times every year and hung out with him and his family. And we did these, all these training camps and stuff like that. And from one day to the next, he literally disappeared off the face of the earth. Like honestly, I could not get a hold of him. I traveled out to Utah to his house to go track him down, short of hiring a private investigator. I went through every means necessary to try to find him. And to make a long story short, it turns out that during our coach-athlete relationship, which lasted years, and we were very tight. This was not a strictly remote relationship. Like I said, we had many, many personal interactions where we were doing camps and things like that. During the entirety of that, he was addicted to heroin, and he was showing up at races still high and or hungover on heroin, and still performing actually kind of quite well, like remarkably well. And I was completely oblivious to all of this. And so after he emerged from getting sober, which is why he kind of went off the face of the map, so to speak, and why I couldn't get a hold of him, he went through and he told me all these things, like this whole thing, like the whole story, right? He's making amends. And I felt like an idiot for not recognizing anything. And the one piece of comfort that he offered is like, listen, addicts are really good at hiding their addictions. And I didn't give myself any comfort in that. I honestly, I beat myself up a lot for missing whatever I should have found. Mm. And so it's with that personal story that I kind of lean into this. When coaches are working with athletes, or you just have a running friend or a running buddy, what are some of the things that they can actually look towards to start to decipher this, to at least get a fix on, maybe I should at least bring this up in conversation or get them some help or whatever, because it has certainly been an area that even in the most intimate coach-athlete relationships that I've had, and this was a really good example of one where I knew him very well, I completely missed the boat, completely 100% missed the boat. So what would you say to people out there that are going to have a similar experience, certainly if they encounter somebody who's going through something like this?
Well, there's a lot of nuance to what may show up for somebody who's dealing with addiction. And your friend was quite right in saying that, it's their job to hide this. So they're very good at it.
Yeah.
Right. It wouldn't perpetuate if folks weren't really good at keeping it out of the sunlight, so to speak.
Yeah.
But there are some screener questions, and this is where I think there's an interesting transition between the worlds of chemical addiction, and we could even use this for exercise addiction. But there's a screener that we use that's called the CAGE, CAGE, and it's just 4 questions. And those 4 questions are ones in which if you have 2 out of those 4, that it's kind of like a little red flag going off, that you answer yes. So they're just yes or no questions. And I'll just walk through it real fast because it's so simple and so easy. And again, CAGE is the CAGE. And the first question is, have you ever felt a need to cut down on your drinking? And this was initially developed for alcohol use. So, but you can insert cut down on your drug use, cut down on your exercise. But that cut down one is one of the questions to look out for. Have you ever felt that you should cut down? And that's asking the individual this. The A on here is about annoyed, and is, have people annoyed you by criticizing your drinking, drug use, exercise, right? So have you thought about cutting down? Have you been annoyed by other people criticizing the way you're engaging in said behavior? Third one, the G is guilty. Have you felt guilty about your drinking, drugging, engage in XYZ behavior here? And so has that been something that's made you feel guilty personally? And then the last one, and this one is a little bit more unique to what we would see with alcohol use disorder, but is have you had an eye opener? That's the E. But have you ever, first thing in the morning, needed to use or engage in behavior to help yourself feel right, to help yourself feel okay, kind of to stave off a hangover with the alcohol world? But any drug, you could insert that there, and perhaps behavior. So those are not necessarily questions you have to use as a screener for everybody, but you can keep in mind that simple CAGE thing, and notice if there's 2 out of this 4 that are present, that this probably could use further investigation. It's not a diagnosis tool. It doesn't say, oh, XYZ. If you got 2, it means you have this diagnosis. It just, these are red flags. And if there's 2 or more, it's clinically significant, and chances are something's going on.
So let's say you had somebody who tripped a couple of those red flags, right? And I'll put a link in the show notes to this questionnaire so people can kind of go look it up for themselves. Then what? So
if you have a couple of positives there, I think at that point, what we want to do is we want to say, hey, let's look at your overall biopsychosocial health and see how it relates to your performance. So we're going to use the sporting context here. And when we talk about biopsychosocial health, the easy in when we're talking about performance is to start with bio. What's going into your body? What are you doing to fuel? What does that look like? And then we get a real honest input on that. And if we find out, well, yes, I'm drinking, are you drinking? Are you taking substances like that? And the idea is, I'm not having this discussion, even if you're a coach, from a place of accusation or judgment. It's just about, let's do an honest assessment of biologically what's happening, what's all going into the system, so that we can use that data to help us find the ultimate performance path for you. You can also jump over to, all right, what's going on with your thinking? What's going on with your feeling? What's happening outside of practice? How are you, what are the mood states you're in? And we're just gathering information. This information is all going to relate to somebody's ability to perform at their best. And then, of course, social, again, is there problems in your social life? If somebody's got addiction, usually each one of these areas, we're going to start to have some data that is going to be dysfunctional.
But what you're suggesting, sorry not to interrupt though, what you're suggesting is the person on the other end picks one of those avenues, biopsychosocial, and investigates it a little bit further. And completely plausible for somebody like myself, right? I have a biological bias, if you want to, think about it like that. I could completely dig into the biological side of it. If it's a friend, they could probably dig into the social side of it, right? Just a friend, your friend talking to a friend, hey, listen, what's going on, what's going on socially. Is that what am I reading through the lines correctly enough there? Is that what you're recommending?
Yeah, exactly. And again, from the sport performance perspective, starting with the biological makes a lot of sense. From a friend perspective, you can start with the social. But the idea is, if we're talking with an athlete, the reason why we're gathering this information can always be linked back to their performance, because all of these parts impact peak performance. And when we're thinking about somebody who's dealing with addiction and we want them to make a positive or healthy behavior change, we have to meet them where they're at, where they have motivation to do so. Folks who are dealing with addiction don't respond to the message of stop doing that. That's bad for you. They know that, right? It's not like, oh, I didn't realize heroin was bad for me. Thank you for that knowledge. I will change my behavior now, friend. That's not how it goes. People know that it's not good for them. So what we want to do is we want to meet them with a goal that they are motivated to achieve. And so with athletes, performance often, not always, but often performance is one in which they're very motivated to achieve. And then what we do is we start to develop an incongruence between the behaviors they're engaging in and the goal they're trying to achieve. And if addiction is a part of that, that's the incongruence.
So here's what a lot of people are thinking. This is certainly what I have a little bit of this thought going through the back of my head right now. Should they just punt it to a professional? Meaning, if I know I have, a friend, an athlete, whoever, that I think needs a little bit of help, should I be the one investigating this as an untrained eye? And I'm saying that I'm kind of saying that for the audience that's thinking that. Should they be the one from an untrained eye being the person to investigate it? Or should they just try to punt it over? Because I've heard both sides of this, because as you mentioned, the last thing addicts want to hear is what's bad for them, because they already know that, right? Mm-hmm. And sometimes punting it over to a professional seems like counterintuitive to that endpoint. So like, what do you say to that? What do you say to the people out there that just want to simply turn it over to somebody else?
That's not a bad plan. I think the key is making sure that you're joining with the one that you have concern about, rather than coming from a place of there's something wrong with you, something that could be shame-based. It's about, I want what's best for you. There's some people out here who could really be beneficial for that. If we go towards the goal that they are motivated to achieve, you can say, if it's an athlete, hey, have you ever thought about connecting with a sports psychologist? They might be able to help you achieve your goals. Biologically, you seem to have everything dialed in based on what you're telling me and XYZ, but we're just hitting some ceiling here. What about that? And I think that referral over to somebody who does have experience or expertise in the area is always appropriate to do. How it's done, I think there's nuance, right? If it's done in a recommendation versus a requirement, is typically better.
Punt is probably not the right analogy to use, is what I'm getting. What I'm getting from that. You like just hey, listen, you need to talk to this person. I don't want to deal with this. Like, you need to be an active. If you really are, concerned about your friend or your coaching colleague or your athlete or whatever, helping them to get the right resources, and you being a conduit to that. I guess that's the better word, conduit. You being a conduit for that is probably better tact.
I think so. Yeah. Because shame is such a component of addiction. The person who's suffering with whether it's a process addiction or the chemical addiction, they are experiencing a lot of shame. And having somebody who tries to counter that shame with support is really helpful and really valuable.
Do you need to let somebody hit the proverbial rock bottom before this recommendation or before this intervention? Or can you catch them before that cliche rock bottom piece?
Yeah. There certainly is an existing cliche about that. And I'm glad you mentioned it, because it's out there. Oh, they haven't hit rock bottom. And for some people, that rock bottom, maybe they lose their job. And for someone else, that rock bottom might be that they're homeless on the street. Yeah. And through the years I've had working with and around folks in addiction, and many of which know way more than I ever will, there was a saying that stood out to me that I thought was really helpful. And it's that you can choose when to get off that elevator, right? The bottom floor for one person is not the bottom floor for somebody else. So there is no, rock bottom that is everyone agrees that's rock bottom. somebody who's in the throes of addiction can always find a way to go lower. And it doesn't have to be, though. You can choose when to open the door on that elevator and get off there.
I really like that as a better analogy. It's like you can choose what floor to get off on in order to course correct, because we've all heard that before. Oh, you just need to let them hit rock bottom. And I've always had me personally, being, as you know, a lot of people will say I'm not empathetic, but I actually really am. Me being an empathetic person, that means you have to let them get worse. That's like against my coaching nature, right? To like let somebody actually get worse intentionally when you know that you can help them get better. And so I've always kind of like wrestled with, when I have had people that I know need some sort of help, like what floor I personally can intervene on, right? Like how low can I like actually let them go? So I like that guidepost of, you don't necessarily need them to hit rock bottom in order to create that course correction.
Yeah, that'll be their rock bottom then.
Yeah, for sure.
That's when they made that decision to change. Another thing that came to mind while you were speaking about that, though, is that no one has the power to make somebody else change or stop what they're doing. And it's helpful to remind folks who are seeing a friend struggle is that you can't control it. You can't make it stop. You can recommend, you can provide support, you can try to connect them to help. But it's really important to know that we can't control it and we can't cure it for somebody else, that's the journey they're going to have to go on. We just want to set up the conditions that make it more likely they go on that journey.
That's been, honestly, personally, when I've had friends and athletes where I've had a relationship with them from tip to tail, as I just mentioned, right? Mm-hmm. The hardest part is the middle, because it has to happen across the other person who's trying to fix themselves. It has to happen on their timeline, not on yours. And they have to eventually kind of figure it out for themselves. And that could take a month, a year, 2 years, a decade in some cases.
Yep.
And it's hard sitting on the other side of that, because you want to do everything for them, but yet you are kind of like helpless as to when that timeline is actually going to transpire.
It is really a helpless feeling that folks and loved ones around somebody dealing with addiction experience.
Okay, so I want to move to another area. You know, we've used this percentage, you know, upwards of 15 or in excess of % of the general population is going to experience some form of addiction, and that is probably heightened in the athletic population. Mm-hmm. That means that somewhere on the other side of that are people who have gone through the process, right, and are recovering addicts. And if I mess up the vocabulary for this, because I've heard it explained a couple of different ways, whether you are recovered or are always recovering, please correct me. But since we are dealing with a population that inevitably has to train a lot, for those people who have gone through that process and are recovering, there's this notion of trading one addiction for another. They're trading their alcohol addiction for an exercise addiction. They're trading their drug addiction for a training addiction. They're trading whatever substance addiction that I can't come up with right now for the addiction of finishing races and getting this big dopamine response, right, from the completion of the event or the celebration of the event, as we mentioned earlier. Is that something that is healthy, or should we be cognizant of? I want to get your professional opinion on that, because I've heard it from so many people in the community and outside of the community that you're just trading one addiction for another. And I don't know what to think of it.
Yeah. Well, there is the potential that you could shift from a chemical addiction to a process addiction, and that could also be as destructive. But you could also shift from one chemical to another chemical, both of which everyone agrees are destructive. And so it can get complicated. I think that the answer is it depends on what it looks like. It can be problematic to shift and continue to engage in an unhealthy way with that new recovery behavior of exercise. But I think that the benefits of engaging in exercise and running in ultra marathons versus methamphetamines, it's not even comparable. And so it's a scale of risk that we're dealing with. And yes, you can have a problematic relationship with a behavior. It could be sex, it could be gambling, it could be exercise, the same way you had a problematic relationship with a chemical. The key is that somebody does that internal work to understand the processes that are happening within them, right? What's happening with my thinking and feeling? Am I able to understand what my psychological needs are and how the behavior I'm choosing to engage in is meeting those needs? And are there ways in which I'm engaging in this new, otherwise healthy behavior in an unhealthy way? And so I think that the risk of that switch, the rewards are so much greater. I would hate for someone to hear this and say, well, if I'm just going to get addicted to exercise, I'll stick with meth. No, we're not going to take that perspective. Engaging in a healthy behavior is encouraged, and it's going to do some things to help with psychological healing. But we don't want it to just stop with, oh, I'm changing from this to this, right? There has to be internal work that's done so that somebody's behavior on a day-to-day, moment-to-moment can be intentional. It can be based on being congruent with their own values, and it can be goal-driven, but they can also be open to feedback from the world about what other people are seeing in the way they're engaging in that.
Yeah. So you mentioned the work, right? The work that it takes to the internal work that it takes to get sober and stay sober. And any of my friends or any of the athletes that I've worked with that have gone through some form of rehab, or it's in a clinic or they go to AA or some combination of all of the above, they always talk about the work. Mm-hmm. And they come out of that process having a greater appreciation for the athletic work that they do being not such a big deal compared to the work that they have done and continue to do in rehab and beyond. So your point of you can't just remove the substance and ask for everything to get magically better. Certainly that is a component of it. You also have to remove the substance and then figure out what was going on underneath the surface. I think is a really salient point in this whole discussion, and in particular for people who are trying to help other people out. You can't just remove them from the situation or take the stuff out of their bedroom or kind of whatever you want to do. You also have to get them help psychologically as well.
Agreed. And that's an ongoing process. Yeah. And the thing that I love about that is that so matches up with an athlete mentality, that this is always a continual process improvement. I can always learn more about me, better respond to the thoughts and feelings I have, and make sure that I show up and behave in a way that matches who I want to be. The same way that I can always work on improving my athletic performance. So there's great transferable skill set here that one can use who loves pursuing greatness as an athlete, that they can apply to themselves in pursuing greatness as the best version of them that they can be.
So I ask you this question kind of in a different context, right? Are athletes more susceptible to becoming addicted to something? Do they also have better outcomes on the other side of it because they have this inherent skill set that they've developed through their athletic endeavors or even a career if they're a professional athlete? Do you see that as well?
I think it depends on what is the context in which they're doing this in. So athletes in general tend, especially if we're talking about high-level elite athletes, they do tend to have a greater amount of resources around them.
Yeah.
Coaches, social support, teammates, all of those factors, and maybe at the professional level, financial and other things that are available to them, which do help and create a better chance for success. And the other part that's there is the physical health piece, right? If somebody's an athlete, usually there is a protective factor that's happening with some of the physical health issues that may be associated with other substance use disorders that are taking longer to show up just because the baseline of health is higher. And that's also going to help them in that long-term recovery process. Now, that's not to say that just because you're an athlete, you're going to get better easily, right? There's plenty of examples of athletes who have died and not made that recovery process occur.
Yeah. And normally it's because they're applying the same level of intensity to their addiction as they did with their training. It's like, I've always thought it's this double-edged sword, right? Because you're so intense in one area of your life, you're going to transfer that intensity to the addiction side of things. But then at the same point, you should at least have the skills to bring yourself out of it, because you've been so disciplined as an athlete, and you should be like more intuitive about your, relationship with everything as an athlete. But it kind of just goes to the whole complexity of it, because sometimes those outcomes are great, and other times, and we've seen, professional athlete stories where this is the case. Sometimes those stories do not end very well.
Yeah, that's true. That's true. And, but it is important for folks to know that if we look at the whole population of folks, people who suffer from substance use disorders, if we look at everyone, there's a stigma out there that there's no hope. It's a hopeless case. People relapse. It's not going to happen. But the reality is most people recover. So most people, more than half, get better. Are there people who die? Yes. Are there people who struggle their entire life and never are able to find recovery? Sure. But most people are able to recover. It does take time. It does take tries at it, right? Different attempts at treatment, trying again and again and again. But most people can make it. And I think that's lost often in popular culture. And I think stigma that exists often makes it seem like people can't or don't. And the reality is most people do. And that hope, that installation of hope about that process is really important for people to hear.
Yeah. And one thing that I've always heard from athletes and friends that have gone through that process is, this might take me a few times. They go into it with the expectation, whether they inherently know it or whether a part of their treatment, and I'm guessing it's more of the latter, a part of their treatment conditions them to, hey, listen, in order to be successful at this, you've got to be willing to continually try and then try again if you do end up failing the first time or the second time or the third time. And I always thought that that's like kind of remarkable, like going into it and going, you know what? Like, I don't, it's almost like a race. I don't know if I'm going to finish or not, right? I don't know if I'm going to get, I don't know if I'm going to get to this particular finish line, this particular like treatment finish line or not. But if I don't, I'm going to pick myself back up and go through the process again.
Yeah. Resilience is key. Being able to do the bounce back, recognize that I'm not going to give up. And again, I love working with athletes because that mentality is a strength that they have, that they've used in a different context so often. And tapping into that is such a useful tool to help folks who are battling this chronic relapsing disease. And I always like to highlight that because of stigma in addiction and substance use disorder diagnoses, the idea of a relapse has such a negative connotation. But if somebody had cancer, somebody had diabetes, and they were trying to get treatment for that, and then there was a relapse and it came back, there's not the message to them that, oh, you didn't try hard enough.
Yeah.
Right. And the reality is, no, we just increased the medicine. Let's give more medicine. Let's go at it at another angle until we beat this disease. And I think that same mentality should be equal across these different diagnoses. And if we take that stigma out and just recognize, no, this is a medical diagnosis, and we're going to keep fighting. We're going to keep treating it until we get it into full remission.
I like these athlete analogies that we kind of keep coming back to, where you can take things from the training process and then also from the competition process, and then apply them into a setting like yourself, a setting like what you work in, where you're working with athletes that are in the middle of addiction. Is there anything else that has been remarkable to you as a practitioner, specifically working with athletes at any part of that continuum, that's important for people to know out there who might have a friend or might themselves be thinking about something like this?
Something that the first thing that came to mind when you asked that question was identity. So athletic identity is something that it starts to get instilled really early in the life of an athlete. And a lot of times where we see addiction start to pick up is when there is some threat to that athletic identity, and it's a way of coping. So you can think about this in context of a catastrophic injury, a major failure in sport, an inability to continue up to the level that they want to continue at with whatever sport that they're in, a retirement that's coming up really fast towards them. And a lot of these stressors are a threat to identity of, I athlete. And to cope with that, the self-medication starts without ever actually knowing that's what's happening, and that I'm afraid I'm going to lose who I am because I am an athlete and sport defines me. And so that identity theme, I think, is really valuable to help folks to round out that despite whatever level of competition that one's in, that athletic identity can maintain. And we're going to use that athletic identity to have success in a relationship to sport and competition that's going to be ongoing throughout life. And yes, it will evolve and change, as all things do, but one doesn't have to let go of that athletic identity. And so that theme has come up a lot. And I think it's important to recognize and understand how valuable it is to folks who have an athletic identity.
So take that identity, lean into it, and then change it to the current context is kind of what I'm hearing from you for athletes that are going through that natural transition point.
Mm-hmm. Yeah. And recognize that they use it.
We see this a lot. Like, I know the Olympic Training Center has put a bigger emphasis on athlete transitions from their kind of Olympic lives to their post-Olympic lives, and kind of arming them with resources. And nobody has kind of the perfect answer to it. But it really speaks to how that change in identity, especially when the identity is very strong, and we do have it with athletes, and I'd say that's even particularly heightened with Olympic level athletes who have represented their country. Those changes can be quite abrupt and quite a remarkable transition from one side of it to the other with an athlete.
Yeah, especially ones that aren't chosen.
Yeah,
right. Because sometimes you have a choice in that, and many times you don't. And when you don't get to make that choice, it's even harder.
Unbelievable. Okay, let's wrap up here. You talked. I want to give the listeners out there a little bit more of a toolkit to kind of work from. So we already mentioned the cage screening tool and went through that. What are some other resources, whether they be websites or clinics or questionnaires, can we kind of arm the listeners with to wrap up with? And I'll put links to all of these in the show notes, and people can go and peruse them at their leisure.
Yeah. One of my favorite websites is recoveryanswers.org. Recoveryanswers.org. And this is a great resource with information about addiction, peer-reviewed articles. All of it is delivering information in a really easily consumable way. It's put together by Dr. Kelly out of Harvard, probably the lead addiction psychologist, in one of them in the field of addiction psychology, and really easily consumable information about the process of addiction, what's happening with it, and recovery, what that looks like, how to seek treatment. I think that's a great resource that anyone can log into, and a lot of easily accessible information for folks. Perfect. Another website that's great when it comes to finding a treatment facility or treatment center is the SAMHSA, SAMHSA.gov. And this is a national organization that essentially is like a clearinghouse about addiction treatment and ways to access treatment. There's easy 1-800 numbers on there. There's easy treatment center finders, and they're going to connect people with well-established and safe places to seek addiction treatment that have been vetted by SAMHSA, this national organization. So I think those are two great resources.
I have used that, by the way.
Have you?
Yeah. This is my caveman toolkit. I'm glad that one came to the top for you.
Yeah. It's easily used. And then there's another website that I think is a nice resource, and it's called Addict to Athlete. And it's ADDICTTO athlete.com. And this is kind of a group of people talking about that process of people who are in recovery, who were addicts, and now they're using sport as a healthy means to recover from that. And, those are, I think, important on different levels, right? So the first website that we talked about is about education. Like, let's understand what we're dealing with here. Get all the information, right? If you're yourself or somebody, doesn't matter. Go there, get the information. The next one is going to connect us to ways to treat or do something about this. And then the last one is about that sustained long-term plan to connect with a community, because connection and community is a really protective factor when it comes to people who are trying to seek recovery from addiction. Having other folks that they can share their experience with, being able to connect, be inspired, and then also inspire other people are really valuable when it comes to the process of finding that long-term recovery from addiction for folks.
I really resonate with that three-prong approach. Like I said, I appreciate that a lot. I appreciate that a lot because, as I mentioned earlier, I've had pretty much caveman tools with this, which is mainly relying on the network that I have, right? I've gone through this experience where I have a good group of athletes that have all been through something like this. And my default is to ask one of them, I'm thinking this, what should I do? Right. And now me and the listeners out there have a little bit more of a systematized resource list out there to go and check up on as well.
Yeah. No one makes the journey alone. That's really important.
Dr. Austin, I really appreciate you coming on the podcast today. This means a lot to me. I hope it means a lot to a lot of the listeners out there. Where can they learn a little bit more about you and your practice?
premiersportspsychology.com. They can find out about the practice there and see a lot of the different services and ways they can connect. We have practitioners located in multiple different locations, and we certainly have the ability to do telehealth care and connect folks to providers if they're outside of if they want to do something in person and there's not somebody from Premier that can work with them.
Well, like I said, I appreciate you coming on the podcast, and more importantly, I appreciate what you do for the community. And you're certainly getting put in my digital Rolodex of people that I can reach out to. So I'm sure we'll have some correspondence in the future, given previous track record and some of the statistics that we just talked about.
Yeah, anytime.
Folks, there you have it. There you go. Much thanks to Dr. Austin for coming on the podcast today and helping me and hopefully helping you, the audience, understand this process, psychology, and behavior of addiction, whether that be due to a chemical or even a behavior like running or exercising or even training. As I mentioned in the intro, this is something that I have had to contend with and to grapple with in both my personal circles as well as my professional network, as well as the athletes that I've worked with. And it's always something that I have tried to become better at understanding as a coach and as a person. I would be remiss not to mention one individual during the closing of this podcast that has helped me the most with this throughout my life. And it's somebody that sadly is no longer with us. David Clark is somebody who has inspired me throughout the entirety of my personal and coaching journey. He taught me more about people who live with addiction and the things that they go through and the things that they have to think about throughout the entirety of that spectrum. David, I miss you, brother. This podcast goes out to you. I hope to meet you on the other side. That is it for today, folks. And as always, we will see you out on the trails.